Okay, welcome everybody. This is the August meeting of the DRACHMA network, and we have a fantastic speaker, which is Dr. Marco Fossati from Strathclyde University, and I believe he's now going to take back control of the screen. So if I get rid of that.
Thank you. Good afternoon, everyone.
So Marco, actually, if you would like to sort of introduce yourself and crack on, then we're raring to go. So the floor is yours.
Sure. Thank you very much, Paul. Thank you for the invitation. Really appreciate the occasion and the opportunity you are giving to me to present a little bit of the work we are doing with CAELUS. Before going ahead, can you confirm that you can all see the screen that I'm sharing?
Yep, it all looks fantastic, Marco. It's brilliant.
Okay. Great. So then maybe, as Paul, you were suggesting, just a couple of words from myself to introduce who am I and what I do. So I'm presently senior lecturer at the University of Strathclyde. I am a part of the Department of Mechanical and Aerospace Engineering, and I am the director of a laboratory that is called FAST. FAST is an acronym that means Future Aerospace Transportation Technologies. So what we do in FAST is mostly look at the development of relatively low to mid TRL level technologies for the future of air and space transportation. So my specific interest and my specific track record is in the area of computational aerodynamics. And this is declined over different types of applications that range from conventional aircraft, drone aerodynamics, but also look at more exotic and maybe exciting types of flows that are the flows surrounding spacecrafts and rockets that are flying at very high speed, very high Mach number. So here with this talk of today, I'm just going to introduce you a little bit to this Future Flight Phase 2 project that we have been very happy to secure as part of the industrial strategy of UK, where we are looking, as the name of as the title of the project says, at enabling what we see as a very important element, that is equity, and ideally increase the quality of the medical offer when it comes to the medical logistics. So when it comes to the delivery and transportation of medical items, such as the usual suspect, like blood and blood products, but we can also look at medicines, components for chemotherapy, high-value medicines, organs, and other, let's say, less delicate aspects, delicate items, such as PPEs, scalpels, etc. So here I am just acting as one of the front ends, the front men of CAELUS, that is currently a project led by AGS, that is Aberdeen, Glasgow, and Southampton Airport. So my talk of today will go over the highlights of what CAELUS is and how it's intending to achieve this target of improving the equity and the quality of medical logistics in Scotland, with an outlook in reality to the entire UK and possibly Europe. And in the second part, I will just focus on one element of the developments that are being done in CAELUS, that is looking at how we can obtain an assessment of the acoustic impact, so the noise that these drones are generating when they are flying, and therefore understand how this could play an element, a factor in the sustainability of this logistic network, where here the word sustainability is to be intended mostly from the point of view of environmental friendliness. So the aviation industry has been now working for many years in trying to reduce not only emissions in terms of CO2, NOx, etc., that we don't care about in CAELUS because we're just looking at electric drones, but certainly we may have an element related to acoustics, but sustainability also from the point of view of the acceptance of the people, of the general public, of the stakeholders in essentially looking at a future where a lot of drones, possibly hundreds of drones, will be flying in the skies, and therefore making some contributions to the acoustic noise and to the quiet that you may want to enjoy if you are on holiday in the highlands, for example. So without further ado, let me tell you a little bit what is CAELUS, okay? So CAELUS has the ambition of demonstrating from a technical, economical, and social point of view the viability of a large, and I will come back later on to this concept of large, but let's say of a large network of drones, so unmanned aerial systems, and fully electric drones, what we call eVTOL, electrical vertical takeoff and landing drones, when it comes to the use of these systems to deliver, to transport medical goods, such that we can deliver efficiency and performance to the NHS Scotland. So apologies, right now the focus of CAELUS is mostly on Scotland, and there are some interesting reasons why we have decided to focus on Scotland and not on the entire UK. I will come back to that later on. On the bottom right part of this slide, you can see what is the structure of CAELUS in terms of partners. So it's a relatively large project in terms of
Marco, sorry to be a pain. I don't think
Sure.
you've moved the slide through. We're still on the title slide.
Oops.
Do you want to try that?
Do you see the slide changing?
No, I mean, it was such a fantastic commentary that it didn't really matter, but now you were directing us to a particular part of your slide. It's clearly we're not on the right slide.
Let me try to do this. Yeah. Maybe this will work better. Apologies if you see some clutter on the back of my screen.
No, it's nice to see some real data being analyzed there. It's fantastic.
So let me see if I now do this.
Yep, you're back in the thing. Brilliant, thank you.
Apologies for that. So now what I was talking about is really, again, the main aim and vision of CAELUS. And as you can see, CAELUS is a project that has quite an interesting number of partners. So the lead, as I was mentioning earlier, is AGS, that you see at the top of the cross in the bottom right part. That stands for, again, Aberdeen, Glasgow, and Southampton airports. We have a number of big names in the aviation industries, just to name one, Leonardo. We have super interesting and very high quality partners in the area of drones, such as AV. They manufacture drones, even if they are not a UK-based company. They have been able to take part of this UK initiative. We have the Drone Office, we have Dronamics with Dronamics are from Romania, for example, and they are also developing drones, but larger drones. We have NATSA, and therefore the hook to regulatory agency, etc. And you may also wonder why we then have partners such as Schneider and Atkins. And the interesting bit about this is the fact that CAELUS is a project that focuses on the ground and air infrastructure that should be put in place to have this network of this logistics network of drones. So we want to have the airborne component, drones, but we also need to have a ground infrastructure in support of this. Ground infrastructure that is needed to, of course, operate and control these drones, but also to charge these drones. We're talking about electric vehicles, and the batteries are not infinite, so we need to think, and that's what we are also developing in CAELUS, about how to deploy a network of charging stations, very much like fuel stations, except that we are not using fuel, but we are simply we simply have a socket where we plug the battery of the drone to be charged, such that we can have, again, a very large coverage of the area. Now, some of you that are in the field may ask, why CAELUS? I mean, There have been in the past numerous examples of the successful use of drones for the delivery of medical items, delivery of defibrillators, delivery of blood, not necessarily exclusively in UK. There are examples in UK that made the news, but there are also examples elsewhere in the world. Now, so they say, what do you want to achieve with CAELUS? What is your unique point? The point is that all these examples, all these projects, and especially those in UK, were single flights, were looking at drones flying on a segregated airspace. So essentially, the guys who want to deliver a certain delivery, they talk to the CAA, they talk to NATS and say, I need this corridor to be cleared by any other traffic, such that I'm sure that when my drone is flying in that corridor, there will be no accident, no incident with other flying entities. And so that's super nice, that's fine, but that's not what we are trying to look at here. So what we are trying to do is really to go to the next step and looking at scalability. So looking at economy of scale. We want to ensure that we have a system that every time that a medical doctor that needs a liver for a transplant and needs it urgently, doesn't need to pick up the phone, call the CAA, call NATS, ensure that there is a segregated airspace between the hospital where he is and the origin where the liver is, and then ensure that everything goes fine. So we want to ensure that the responsiveness of the system is up to standard and can really help saving lives. So this means that we are looking at this open sky framework where you have drones, you have civil aviation, you have any other flying object, all in the same ballpark, all in the same playground. And so they can fly together, but they have to fly together in a sense that they must be able to respect elements such as safety, security, avoidance, etc., etc. So this is where we are trying to go with CAELUS, really to scale up to a global, maybe it's too excessive, but I mean a very large scale in the operations of drones. And that entails, that requires that a number of points, and I've started indicating a few of them here, but again, this is something that you are certainly aware of, needs to be addressed. At the beginning of it, there are the regulatory aspects. Nothing is written in stone, everything is really very in early stage in the regulations for the use of drones. Social acceptance, I was mentioning earlier. Urban and rural setting, and this is why we have an interest in Scotland. So we need to ensure that this type of logistic networks performs in an effective way, and ideally in an efficient way. If we are flying across a urban environment where you may have houses, you may have skyscrapers, you may have, again, a certain cluttered space, but it works fine also when you are flying in rural settings, where you may be flying for kilometers, miles and miles, essentially with nothing around you that could be either of help if there is a problem or something else. So that is an important element of CAELUS and the interest in Scotland, because it offers both scenarios, both landscape. And most importantly, we need to ensure that we are able to demonstrate, for example, to the stakeholders, to the general public, and to the regulatory people that our technical solutions are of sufficient TRL level, such that we are really good to go with the use and the operation of this network. So that's why CAELUS is really a multifaceted project with these 4 macro elements in it, so sort of 4 sub-projects within this big umbrella. So we are talking about a digital twin demonstrator that will be looking at developing, as the name says, a digital twin of the entire network. The vehicles, the ground infrastructure, the operation, the communication, the fulfillment app, in the sense that you want to ensure that in this system you have the possibility to model and to simulate a doctor calling for a certain amount of units of blood, and then you see that it is going in the right way. We want to address the economic viability. So we want to assess the fact that when we go and compare this future system with what is currently done right now by looking at vans, bikes, taxi, or other means of road transportation or sea transportation, we have an economic advantage other than a sort of almost natural advantage in terms of the time of delivery. We are looking at demonstrating this beyond visual line of sight, BVLOS trials in non-segregated airspace. So we want to ensure that we can demonstrate that when we will be flying a drone without seeing it with our naked eyes, but simply looking at the instrumentation, at the telemetry that the drone and the control center exchange, everything is safe to be operated. And then we have the element of public and social perception. We need to ensure that we are not developing and working towards something that the people will not see favorably, the general audience. So the digital twin is the element that I would like to explain a little bit more, because this is the element that is more close to my role and to the role of Strathclyde in CAELUS. Is really looking at a really complex system of systems, right? Where, as you can see here, we have aspects related to the modeling of the UTM services that take the order from an hospital or from a laboratory or from an accident site, and then on the basis of this generates the trajectory of the drone, inquires a database of the NHS that tells where is the blood that we need and how much do we have it, operates and starts instructing the drone that has to fly from a certain drone port, go there, take the blood, fly to the site of the accident or to the laboratory, dispatch the medical product, and then everything is successfully completed. And there are a number of elements in the definition of this digital twin that make it a very complex task. And the way we are looking at this digital twin is twofold. So we are looking at developing a digital twin that can be used for the design of this logistic network. So we want to use it as an element when we are deciding, okay, where do we put the charging stations? What are the hospitals that we want to connect first? What are the routes that we want to fly? What are the drones that we need to have and where? But also an element, the digital twin is something that we want to use during the operation of the network. So in the near future, we hope that this will become reality, but we want to have that the digital twin will still be used, for example, to resolve and to provide contingency plans. So to help the operators in providing solutions when critical situations take place. For example, there is the storm of the century that is taking a certain bunch of the UK area and excluded from flying through it. So we need to reschedule, we need to think about what to do. How can we deliver that specific organ that is needed at that hospital in a given time frame? So within this part of the digital twin, as I said earlier, we have this particular interest in assessing and modeling the noise that the drones generate while flying. And we have, now I wanted to avoid annoying you with equations and formulas, because I know that I lose the attention very immediately. So I just want to stick to the concept here. And the concept that we have been developing is really a concept that will allow us to model, for example, the noise generated by a drone like this one. This is an AV drone, and it is an electrical and vertical takeoff, because you see the four rotors that you have here. These are used only for takeoff and landing, but during cruise, so when it is flying from origin to destination, these are switched off, and the propeller that you see in the back is the one that is pushing and generating the thrust. And our model is aiming to address the noise generated by each propeller disc, that is a sort of conceptual representation of the disc that is spanned by all the blades whenever they spin, looking at the noise that is propagated from the propeller up to a certain observer. And we have implemented a model that looks again at the fact that there are certain pressure fluctuations associated to the aerodynamics of these blades. There is a certain amount of energy that is then converted into acoustic energy that is then propagated through the space. And we came up with some interesting analysis, for example, like in this case, where you can see an example of the acoustic impact of a drone, the drone I was showing earlier, flying from Glasgow Airport to Golden Jubilee Hospital. So this is a flight that takes 15 minutes-ish. The drone is flying at 120 meters, and the colors that you see on the ground are associated to a sound pressure level. It is one of the different measures that can be used to assess the acoustics. I will come back later on in explaining what different color means, meaning is this super loud or is this acceptable? We'll come back to this later on. But so we have made analysis like this one, but we have also tried to do something that is a little bit more complicated than that, where we say, well, we don't have one drone, but we may have, for example, two different drones that may be flying on a certain region in a similar period of time. And you can see here the composition of the noise generated by the drone flying along the blue route that is the same as before, and another drone that is instead flying the red route that we have just put there for as an example, because we said undefined origin and destination. And here you can see a little bit how we can map this noise, right? So you can see that whenever you see red, you have a noise that is equivalent to your TV set at home with a moderate level of volume. Wherever you see dark blue or even below, it's the equivalent of leaf rustling. So you can see that even if it seems that, wow, the impact of that drone is huge, if you recognize that here we have the Clyde River, right, that is flying, and here we have Glasgow Airport, you say, well, if I am taking off here, I mean, I go very far. But in reality, so here, this is just sort of numerical analysis. This is really very, very low noise, so you can really not hear anything. So other type of analysis that we made, we're looking a little bit at assessing how many drones we can really fly over a certain route before hitting levels that the current regulatory bodies say that might be a little bit too much and will not be accepted. So in this case, we have changed a little bit the metrics. So we are looking at sound exposure level, which is essentially the same measure as before, sound pressure level, but normalized to a second. So the actual sound that you see instantaneously is lower than this one in terms of decibel. But this is a way to combine together flights that have different durations. As we said here, so here we consider, for example, that along this route, again, Glasgow Airport and Golden Jubilee, we explored 6 flights a day up to 96 flights a day. So 6 flights a day means that you have 6 drones taking off from Glasgow Airport every 4 hours. 96, they are flying, they are taking off every 15 minutes. And again, we started to come up with statistics and numbers that show a little bit how we can push the use of drones. So this is another analysis here that we made, where instead of having a number of flights, one in sequence, we are looking at parallel flights of drones. So here we have, for example, in the case of 2 drones, one drone that is taking off from Golden Jubilee, one drone is taking off from Glasgow Airport, and they fly virtually the same route, not exactly the same one. And we see that, again, this noise level changes a little bit. And we came up to the point of saying we have 10 drones flying on that route simultaneously, while in the first case it was in sequence. And we have done similar analysis for other interesting routes. This is a route that is of interest to the NHS, is connecting the Crosshouse Hospital to the Arran War Memorial Hospital. It is somehow considered a sort of rural route in the sense that apart from the sea, there's not much of urban settlements except from the few cities that you see there. And interesting, you see, using the same matrix, the noise becoming more relevant along this altitude. So this is sort of hill that again, it's not at sea level. So you can see that these three colored areas indicate that noise here becomes a little bit more interesting. And we've done, again, a similar analysis. In this case, we considered a quad rotor other than a fixed wing one. Again, subsequent flights from 6 to 96 and parallel flights from 2 to 10. And again, we are start developing, again, generating numbers that we want to use to, again, instruct the design of our digital, of the drone logistic network, but also support the demonstration to the eyes of the authority, to the eyes of the general public, that we are not doing something bad. And I would like to stop here. So thank you for your attention. Happy to take any questions. Don't know if I've respected a little bit the time. Probably yes.
Hi, Marco. That was fantastic. Actually, a really interesting aspect that I think many of the developers and service providers are thinking about, but I don't think anybody's articulated it and modelled it so well. So that was really good. So the paper's open. Do we have any questions? I've got one question from Alex, and he said that he's having trouble with unmuting himself. So I'm going to read out the question, if that's okay. Is CAELUS looking at more technical value proposition or medical business case to make it effective? With the NHS being a fragmented affair, who pays for this in the long run? So do you have any feelings about that sort of, is it a technical thing or a business case that you're developing? I guess you're developing both, really, aren't you? Or?
Correct. Yes, we are developing both, in the sense that right now, so there are certainly some technical hurdles that need to be surpassed. And so despite the fact that, for example, from the technical point of view, BV loss is something that people can do. It has been demonstrated. It's not new. But we want to demonstrate it, again, in non-segregated airspace and ensure that the safety of these drones, the accountability, the telemetry is always kept in control. And to tackle this technical aspect and regulatory aspect, we need to demonstrate that. So we are developing technological solutions in response to these aspects. But as you said, we are also tackling the economical aspect, so the business case part. And so if I can go back quickly, apologies if I make you seasick, but so the second aspect here, that is the economic viability, is really at the center of CAELUS. And this is because whenever we have been engaging with the NHS, with the Scottish National Blood Transfusion Service, and they are, of course, super interested, and we have been talking to National Service Scotland, and they, apart from the technical aspect, they really want to see the numbers in terms of money. And this is an element that is currently being developed by the Connected Places Catapult. There is developing, has already organized a number of workshops with NHS, the various boards in Scotland. So we have 14 NHS boards in Scotland, and they're all following this closely. And in the long run, it will be in the long run. Well, maybe not in the long run, but let's say in the immediate customer of this service will be NHS. And it will be NHS that will, in this sort of vision, pay for this service of drones. And NHS is trying to assess with our project if the cost of running this system will be better, the word will be lower, than running the current system with vans, with cars, etc. So this is something that goes a little bit in parallel to the time of delivering a certain item. Fine, but again, the economic aspect and the business aspect is there.
Fantastic, Marco. That was great. I've got a couple of questions that I've asked. I've not got anything from the rest of the group, so I'm gonna crack on with this. What about buildings, Marco? I'm in London. I'm not in Scotland. How will that impact on your model? The reflection of the sound from the urban environment.
Yeah, this is a super important point. So right now, the model that we have does not account for the reflection of the sound. So right now, what we have is a model that is simply accounting for sound hitting a certain location. So if we have, for example, attenuation of the sound by certain means, if we don't have effects related to the Doppler effect, so to the fact that you are moving and therefore the sound, the frequency of the sound will change if you're going in one direction or the other, meaning if the drone is coming towards you or going far away from you. So right now we don't have these elements there yet. I'm not sure we will, as part of CAELUS 2, so CAELUS phase 2, we will have the resources to address that point, but we're working towards phase 3 where we can push a little bit the bar a little bit higher. But you know, phase 3 is more it's a strong focus on demonstration. So.
Yeah. Oh yeah, it's a very tricky subject. So yeah, it's the start of a long project, I think, really. And a very cheeky one. I'm kind of advocating this a little bit. Is what about slow drones and airships? You're looking at sort of rotor quads 4, 6, 8. Is there any place for a kind of blimp, an airship, a small airship that moves very slowly across the airspace? What are your opinions about that?
Now, this is one interesting point, and I mean, I'm sort of smiling because we had a number of conversations about it. So let me talk about this in terms of the different use scenarios that you may want to have for this drone logistics. So you may want a system that is working in what we call responsive mode. Okay, so you have an accident, you need to bring blood to the site of the accident to start the treatment there, as an example. Or again, you need to have some organ transplant and then you need one and see if you have anything available. But there is the other type of use of this network that is scheduled delivery. For example, you know that you will need to provide supplies to hospitals, laboratory of certain items. Right? They can be medical components, they can be whatever they want. And in this case, what we started looking at is mostly using larger drones. So not not small, relatively agile and fast drones, but large drones that can carry large volumes. Okay, and this is an element that right now we have in CAELUS thanks to Dronamics. That is one of the partners. They have a large drone that's basically a small aircraft, autonomous and flying, and it's okay. But certainly this idea of looking at, again, airships that may fly in a little bit lower but could allow having larger volumes is going definitely in the direction of this scheduled delivery, right? So you know that now instead of having a lorry that makes the tour of various hospitals delivering stuff, you now have an airship, maybe not a huge one, but a relatively smaller one that goes there. But that's certainly an idea that is there. It's not in the direct and immediate focus of CAELUS, but it's a little bit in a corner of our minds.
Oh, that's good. So not a crazy idea. Slow friendly drones rather than sort of nippy kind of fast ones. I've got a couple of questions. Dennis hasn't asked one yet, so I'm going to ask Dennis Dennis's question first. He's having mic problems. Ask a question. It is regarding the payloads. What kilograms are they trying to move? This relates to economics of moving small things, single items, and the size of the heavy drone, where the heavy payload may be more quiet. So, well, I think we've kind of touched upon that, but it's just to give some examples. What are the sizes of things that you want to transport? What are the weights in kilograms?
So right now, if we look at the drone I was showing earlier, this guy here, this guy can carry a payload of 2.5 kilograms, well, up to 2.5 kilograms, which again, it's not very large payload, but also this drone has approximately 2 meters of wingspan, so it's not a large drone. It can fly at 70 kilometers per hour, so right now, again, we are mostly focusing more on relatively low payloads because we are interested into this responsive mode type of operation of the network. AV and in our network, thanks to Leonardo, are working on a slightly larger drone where we can push the payload up to about 10 kilograms, just the medical payload. The other drone that I was mentioning earlier from Dronamics, it's called the Black Swan. Well, that can carry much more than that, but again, we are not looking at tons, if that is the question, right? So.
Yeah. Medical things tend to be of the grams and kilos, not the tons.
Yeah.
I've got a very good question from Alex, and I think it's very pertinent. So it's a follow-up question from Alex from Euron, with over 90 objections to a recent airspace change proposal from the GA community in Scotland. How are the local non-drone aviation stakeholders being brought into this? TDAs are now being considered a brick wall. So have you had any problems there?
Well, I mean, if you see the last part of this of the project, the last point, not the last part, there is a public and social, let's say, acceptance, and I guess that if this is the element that is being asked in the question. So we have recently gone through a number of workshops, not workshop, surveys that have gathered some of the opinion of the stakeholders and of general stakeholders. So we didn't make any specific, let's say, selection of people. And so right now, I don't have all the numbers with me, but we saw that overall, when we were looking at a general metric that was looking at aspects such as not only annoyance, visual cluttering, but also safety, security, ensuring that the medical product reaches the destination and it's still in the conditions that can be used. It's above 70% of positive feedback. But please let me know if I have not answered the question, because I might have gone on to this and not picked up everything.
No, I think that's been covered well. I think quite rightly, Alex has corrected me a little bit there, because I'm a non-aviation person. I come from a physical chemistry background. So is there anything? Have you had any trouble or issues specifically around temporary danger areas in these kind of conversations around sort of approvals?
This is something that is sort of being addressed in the part of BVLOS trials, and is taken care when we are looking at our, again, flight trials. So I don't seem to recall that they have had issues, but maybe they have had, and I'm not aware of. So it's really cannot answer to that specific one.
And I think Alex is almost giving you some advice here. Is get the glider community, the balloonists. We have a lot of people. Oh, here we go. It's a fantastic little clip here. That it's actually really important. I know of other applications whereby the local glider club down in the south of England have extended a project by a couple of months because they're objecting to everything. Again, Alex he's really annoyed. He'd love to speak, and he's a stalwart of this community, but he can't. His telephone or his laptop is not functioning properly. So there's a really good link there, I think. So I would have a look at that for everybody if you're considering these applications, because they can cause you all sorts of time delays. So I think,
certainly the guys who are following the development of our BVLOS, maybe they have been in the same sort of fight with these clubs, glider clubs. I am not aware of it, unfortunately.
And your comments around noise, absolutely relevant. Again, a couple of the projects, I don't want to give too much away, but are around existing helipads, and there is a certain limit on the number of flights due to noise, and reassuring the local community and the local councils that the noise is below a particular threshold, and so won't add to the burden, and thus take away the number of available flights for the air ambulance is something that has been discussed in a number of projects. So really pertinent, I think. Fantastic. So I think we're about there. It's a lovely conversation. So Marco, that's brilliant. Thank you very much for your presentation, and for the one or two people that turned up a little bit late. And I do appreciate that internet is not that stable around certain times of the day, and B, many of us are on holiday. So thank you for coming in. The presentation is being recorded, so I can circulate that quite quickly after the meeting, and I'll do that via the Teams link so you can look at that. So if you could stop sharing your screen, Marco, that would be
definitely, yep.
That would be good. And what have we got now? So if I share my screen, I've got, if we go to here, so I've got screen 3. I'm sorry, Marco, you're going to see a picture of yourself again. So can everybody see that? I think we can. So we've got Patrick Courtney, who's a co-founder of DRACHMA, and he was going to give us a little overview of where we are, the highlights of what we've been doing, and then at the end we'll start to open the conversation up in the last 5 or 10 minutes around some of the challenges to the drone community. Patrick, are you there?
I'm here. Can you hear me?
Yeah. How do you want to do this? Do you want me to change the slides, or do you want to have to put up your own version of this?
No, I'm happy for you to flip forward when I ask you to go for the next one.
Yeah, absolutely. So I'll do the next one, which is our first.
Okay. So let me grab the microphone. Yeah. So as Paul says, I just wanted to take an opportunity to look backwards. We've Paul and I have been working on it. Paul's been more the public face of this thing as he chairs the questions and so on. It's been a fantastic talk today already with Marco, but I thought it was worth looking back on what we've achieved, and also with the objective of opening up the floor and taking input. This is meant to be a community thing. Obviously, Paul and I are kind of driving it and inviting people, but we know we miss things. We know there are things that we don't think of. So I'm just going to go the next few slides to take a look backwards at the presentations we've had and what's coming up in the very next couple of ones, and then a list of topics as to what we have heard as relevant, and just to try and see if we can, you got me in the middle there, sorry, just to see if we can take some input and move forward on things maybe we've missed. So I'm not going to do justice to all of the great speakers we've had. We've been so lucky with the speakers. We've been so lucky with the audience and the great questions we've had. So I'm not going to dwell on how supportive and how helpful and how motivating that has all been. But just quickly, so we started in April, 1st of April, was a good day to start. And we had Dee Wallace from Oxford and her colleagues talk about some of the experiences they've had, really from a user perspective, a community's perspective. And the other talk was from the people at Apian, who've got some new drones in the UK and really doing some nice networking and collaboration across the quite complex landscape we have in the UK. And every country is different and every country is complex in its own way. But that was a great kickoff talk. Paul, do you want to go to the next one? Yeah, then we, recognizing that we want to touch a community that's much broader than the UK, we started to reach out more broadly. So Astrid came in based originally from Switzerland, but working in Madagascar, talked about her experiences there. Quite eye-opening and jaw-dropping images and stories about the complete lack of roads, the quite different geographical situation that they find themselves in now, and drones, the value of drones in such an environment. And followed up by Sheldon from Canada, giving us some great presentations on defibrillators, and the learning for me there was that the drones are well supported, but not everybody knows how to use a defibrillator. So the technology and the people, there's often some surprises as to how those things interact. Can you go to the next one, Paul? Then we took talk from Patrick Meyer from We Robotics, gave us a number really of really interesting case studies from around the world. I can't remember all the places. We were in Latin America, we were in the Pacific, we were in Nepal. Huge number of little vignettes there. Very, very interesting and some great discussion. And we took a little bit of feedback on what time of day we should be doing these meetings. I think we've still not bottomed that out, and we're still missing involvement from the audience in the Americas and Asia. We barely touched right now, so we've got to fix that, Paul, in the coming months.
Absolutely. Sorry.
Move on to the next slide, please. Then I think at the last one we brought in Gabriella from a group in Canada, talking about some of the more infrastructure issues, about what would happen if we didn't just run individual pilots that made great press releases, but started to collect some data and pool the data. The aviation industry does a great job with black boxes, and the aviation authorities do log information on near misses and so on. But as a drone community, how could we do that? And she proposed a scheme where she's already started actually collecting some of that data and making that available. And then we took a step back on looking at some of the supporting enabling technologies. We've asked this from King's neighbours here to look at some of the 5G and communications and other ways in which drones and swarms of drones, multiple drones, could be supported. Next slide. Well, that brings us actually to today. So just looking ahead, if you can read the detail on those, we've already got a lot of speakers lined up. Everybody's busy and not everybody makes it, but just to give you an insight into what we've got next month, we've got some input from UNICEF and their experiences in the humanitarian context. We're going to link that up to some of the experience at Cranfield in the UK about safe operations, so possibly a little bit of an overlap with what we heard today, but some aerospace engineering sort of input on that. On October, we've got a group from France, south of France, who've been doing some great work bringing together the drone suppliers, the service providers and the hospitals. I don't think we hear too much about that. Language isn't always our friend there, but Hubert and Marion have agreed to come in. And then we're also going to take some input from what's happening in India. We came across some really fascinating work happening there. We find that some countries are much more open than we expect them to be on how things can be done, the regulations, and also open to fresh new ideas. So Suresh is going to come in and talk to us on the experience there. In November, Alex will give us the benefit of his very, very broad and deep insight, and Annalise is going to come in on some of the experience again from a more structural, regulatory, right way of doing things. And December, we've lined up a colleague from Switzerland who's got a very interesting drone design, which is user-friendly, and Tom from Birmingham, and giving us some clinical input. So if you can remember any of what I've said in the last 10 minutes, we've really tried to cover the user view, the clinical view, the technology view, the operator view, the regulatory view. It's so complicated, but that means it merits coming together, discussing, presenting and sharing. And thank you again for all the questions and discussions we've had. So Paul, I think on the last slide, we try and bring together a summary of some of the topics we've spotted, more immediate ones and some of the more future ones. Data touched on there, use case evaluation. I'm not going to read them all. Weather, we've not really touched on too much. All the nice pictures of drones, single drones on sunny days, is starting to become a bit repetitive. And we know in Scotland, for example, that's not always the case, certainly in winter. Acceptance, I really liked Marco's touching on the discussion we had on sound and noise, and more future facing scalability. How can we benefit from all of the different things we've seen and heard? Carbon net zero, the sustainability aspect, which is a hot topic now in many quarters. Coming back again to drone design, we have people in our group now who know about drone design. What are the the new things that people are not quite looking at. Again, Marco touched on that a little bit, and so on, and funding finally. So we've done all this a little bit freewheeling. It's been great to have all the input, but we benefit from the projects that are funded, that people have come in and be able to talk about. But maybe as a community, we should be seeking some funding to try and help us to go further and do some real things and fill in the gaps between what the existing projects and research agendas try and carry out. Paul, do you want to add anything to that?
Yeah, that was tremendous. Thank you very much, Patrick. No, there's an apology straight away where, if we just go back, the top 4 have confirmed. Annalise and Tom have confirmed. I've very sneakily reached out to Alex and Shemek, and so they're yet to confirm, but it'll be great to hear from them. In the chat, which is really good, Alex has mentioned a Singapore group that I will follow up. That seems very good, because I know Singapore, around Malaysia, lots of islands, lots of logistical things going on, a very good health service, but it's very pushed in terms of geography. So definitely following up on that. And of course, I think some of the Skyport work has been done around Singapore in terms of sort of these sort of autonomous taxis that are flying people around. So it's a space where people can actually do, I think, quite a lot of supported testing, and it's very open for drone development. If we go back to this slide, something that's occurred to me, and I know Patrick and and if I go back to this one, an apology, I am not the most organized person in the world, but this plan is looking good. So what we're going to try and do is get more of an agenda sorted out earlier for you guys, so you can see things that are coming up. But if there are people that you want to hear from, please get in contact with us, and we can reach out and see if we can twist some arms to get some people in. Another thing that I think I'd like to do, and I've got 2 or 3 minutes left, is there's a number now, students, people doing smaller projects, that kind of thing. So perhaps we can see if we can organise some kind of virtual poster session or a series of shorter talks, and perhaps put them up over a rolling 24-hour period, whereby everybody from different parts of the world can view those. I know the Royal Society of Chemistry does a really good virtual poster session, and it's actually delivered on Twitter of all things, and it actually works a treat. Alex has popped up. Could you pop in a shareable link to the document or make it comments only? The reason I say this is because there's a government group called the Regulatory Horizons Group at BS level, and it would be interesting to confirm the overlap. So yeah, we'll sort that out. Actually, I think Patrick's nodding there. One thing that I do want to say right at the end in terms of funding, Patrick and I have reached out to the KTN network, the Transport Network, and the Health Network there, and also the Future Flight Group as well. And even though we're not as a group, the group itself is about communication, network, developing new ideas, supporting people. I think one of our sort of aims was to see if we could twist that funding body's arm somewhat, to see if we could get a little bit of funding to get this, sustain this network, I think, and also give us a little bit of budget for, websites, bringing people in, and perhaps the odd pilot project as well. So that is something that Patrick and I are thinking about. I don't know whether the group here is supportive or negative about that idea in terms of applying to the Future Flight 3 to actually fund some of this. So any sort of support and stuff would be good. So assume you also Future Flight 3 was launched this week. Oh, perfect, Alex, you're on the same lines, and it's commencing November to April. So the one thing that I would state from there, if there's some newer people to the sort of drone space, something that was emphasised in that they are open to new groups and new consortia coming in, not just the groups that have already been funded. Obviously, they'll be looking for a coalescence of studies and expansion of much bigger projects, but there is some space for people that haven't been funded from that scheme. So we've got a minute to go, and of course we've chatted away. Any other comments that the group would like to raise? Is our summary of the challenges, the immediate challenges and future challenges correct? Or are there any things you would like to be added to that? It's all
well, Paul, if I can maybe add one point. Sorry, apologies for this. So I think that what it is all shown here is super important. But for example, one element that to me is probably spread and hidden among these various points is the fact that in a future where we see the use of drones for medical purpose becoming, let's say, let me call it the normality, right? But maybe it's not going to be the normality, but in any case, very, very diffuse and very popular. I think that one important element would be to really try to focus on the design of a drone for medical purposes. In the sense that when I talk about design, I'm talking about the airframe of the drone, the shape. So how will it look like? What will be its interior structure? What will be the power system? You know, we want to go all electric because that's nice and we save a lot of environmental aspects. But I mean, the trend of having a sort of retrofitting existing concepts of drones and design and airframes to, let's say, accommodate the medical use is certainly a valid option and is the fastest way to market. But maybe there might be an interest in bringing together at this point, I don't know, people from the ATI and other manufacturers and designers to say, why don't we design a drone that is tailored from, I mean, ab initio, from the beginning for the delivery of medical drones. And this goes along the way of saying, how do we put the load on, we take the medical package off, how do we charge it along the way, etc., etc., that could benefit from, again, holistic redesign of the drones.
Mark, a fantastic comment there. I probably haven't done your comments justice in the chat, but I've just added those so we can capture some of those comments. Absolutely. I mean, one of my personal sort of issues is everything's slung underneath, because that's fine. It's stable in terms of the aerodynamics and stuff, but then trying to get it out of the drone is quite difficult. And also, if it's landing on something, we've got to worry about infection. And so if it makes a false landing in a field and everything's safe, but all the grass is now touching the box. So is there an opportunity to place the cargo somewhere else? And also, I mean, there's a very simple thing that I've been in another meeting recently, painting the color of your drone. What does that mean to the people on the ground? And will they recognize it as something as safe and supportive, or will they be, very anti having that flying around? So I think that's great. I mean, there could be something in future flight where we all come together and design a bespoke medical drone. I think that would be very, very interesting, which is good. I do have an eye on the clock, and so we always overrun a little bit. So we're 2 minutes over. So and Alex has put something fantastic in the chat as well. Alex, what does that refer to? So I could just draw people's attention to it. If you could just type I've got something that's Instagram. Is that something to do with a particular design of drone? Can you just pop that in there, Alex? Is he going to write something, and then I'll close them in. Oh, it's a new drone design. Fantastic. As always, we always have great ideas, and somebody else has beat us to it. But let's all have a look at that. Patrick, do you have any closing comments?
Only just thanks for everybody's support and involvement. It's been I'm a bit surprised and pleased how engaged we've been and how open we've all been, and that's just a good sign for the future, I think.
Yeah. Thank you, Patrick. I'm now going to stop the recording.